So you've spent years studying medicine, right? You've had late nights, endless textbooks, you've skipped holidays, some even skipped some family important meetings, countless sacrifices, some sacrificed some significant relationships, some sacrificed some travels, some even sacrificed some portions of their health because we're trying to get things done to become physicians, right? And it's all for one purpose, to wear that white coat and to truly make a difference in the life of the members of the society, the lives of the members of your family, your own life. But then the unexpected thing happens and you fail. That's the thing. You fail. You fail either an MCQ exam, a typing exam, an OSCE, an assessment, a licensing step, for example, MCQ1, NACOSCE, therapeutic decision making, USMLE, PLAB, whatever it was, it will shake you. And suddenly you are questioning everything in your life. And if that's you, I really, really want you to stay with me because this moment does not define your future. And I'm going to walk you through what you have to do next. So whether you are an international medical graduate or you are currently a medical student, and whether you failed the MCQE1, the USMLE, the NACOSCE, the PLAB, the AMC, Australian Medical Council exam, or even a major exam in medical school, I need you to really hear me clearly. You are not alone. You are not alone. Failure in medicine happens more often than people talk about. The truth is, many people hide it. We bury it as physicians, and we carry the shame quietly because we are doctors. We don't want anyone to know. And we are expected to be very good. We are expected to be perfect, right? Because we are going to save people. But the real growth comes when that silence is broken and you can actually say, hey, I failed, but I'm not giving up. And so now I really want us to start rethinking failure. So for us, planning for an exam, an OSCE, an MCQ, and especially for those who are preparing for international exams, I really want us to rethink it. Most people assume failure means you weren't smart enough. But that is not the truth entirely, okay? I've coached many doctors over the years, and this is what I've seen over and over again. I've seen brilliant, dedicated, capable doctors. Some of them were even heads of departments. Some of them were professors. Some of them are people who are looked up to in their various universities, and they have also failed. Because no one trained them for what happened during the exam. Some of the reasons could be that the exam is written in a different style than they are used to. It could also be that there's even a language barrier, right? In the way the person was getting the communication, in clinical communication. There could be cultural gaps in patient care and expectations so far as that particular exam is concerned. There could be the lack of a strategic preparatory program, which would guide this candidate into the exam itself. It could be that the candidate was even studying alone. The candidate was confused, overwhelmed. And another thing I've realized is sometimes it's just simple burnout. Some people are just burnt out. They are so exhausted that they don't know what to do. So it's not only about intelligence, it's also about a system that you are trying to navigate. And you can learn to master that system, whether it's the Canadian system, which I usually teach about, or the United States system, the Australian system, PLAB, whatever, the South African system, whatever it is. So let's break it down. If you failed a major licensing exam like the MCQE1, you usually have multiple attempts. And at times, dependent, there may be a waiting period. Yes, and there's also a financial cost as well. The cost of, at times, taking time off to study, the cost of re-registering for the exam, the cost of not working for a couple of months and so losing income. It comes at even a psychological cost as well. The cost of you doubting yourself. And for some of the exams, like the NACOSCE, where you at times need to travel into the country to take the immigration consents, right? These can all complicate your timelines. And these can make things a bit difficult. But again, that is not the end. It just means that you need to change the strategy you are using. And for IMGs especially, you are really not behind. You are learning to succeed in a new system. And that takes more than just knowledge. It takes adaptability. It takes support. So the issue is, what do you do now? That's the question, what do you have to do now? I'm going to give you a 5-step comeback strategy. 1, 2, 3, 4, 5, right? So whether you fail the MCQE 1, the USMLE, the PLAB, the AMC exam, the NACOSKI, the therapeutic decision making, I'm going to give you a 5-step strategy. And the first step I want to give you is I need you to pause and process what is going on. Just take a step back, take time, acknowledge the disappointment, imbibe it in, grieve the disappointment, get a journal, right? Write it down, talk about it with, people you know. You are human before you are a doctor and you need connection. So get maybe a mentor, someone you respect, someone who probably was in your medical school, somebody you were studying with, because during these times you form a lot of study groups and study buddies, right? Talk about it. Remember, you are human. Number 2, I want you to diagnose a failure. What really went wrong? Was it time pressure? Was it gaps in the content you were studying? Was it a panic attack mid-exam? Because I've even had candidates who they are used to a particular way of doing things, and then a day before the exam, they go to take medications which can help them to relax, and that can mess them up. The issue, the reason why I'm talking about this is because you need to take time to diagnose the failure, because you can't treat what you've not diagnosed. After all, you are a doctor, so you understand. You can only give treatment to something you've diagnosed. Number 3, the third thing I need you to take note of when you are planning a comeback is get expert support. Don't do this thing alone, okay? Find mentors, find a coach, find a steady community that understands the international pathways. That one step can change everything, because at times you've tried it on your own, you've tried to do it on your own, but that one step can change everything. The 4th point is change your method. Less passive reading. Don't just focus on reading, but do more of clinical reasoning, more case-based questions, more simulation under time pressure. And that is why I really, really encourage that you take as many mock exams as possible. Don't just say, oh, I've done a question bank. That is important, but also do your best to do as many question banks as possible and do it timed. So for example, the Medical Council of Canada has questions you can buy and you can do it in exam mode. Do that. That helps. Okay. Think like a test maker, not just test taker. So just think like the way the examiners would want to set a question. If you were an examiner, how would you set the question? And number 5, rebuild your confidence. This might be the hardest part, frankly, and it's easier said than done, because there's this voice in your head which is loud after failure. And that's the truth. Okay. But you have to talk back that voice. You have to let the voice know that, look, you are not going to overcome me. You didn't get here by accident and you won't stay stuck. So, I've worked with hundreds of medical learners around the world, from Africa, the Middle East, North America, Australia, everywhere. And some have failed. Some have failed once. I've even had candidates who have failed 3 times in their exam preparation. And some were ready to give up and, just pack their stuff and just board the airplane and go back home. But then they ask themselves, when I go back home, what am I going to say? So many of them did not do that, but they changed the way they studied. They found the right resources, they practiced differently, and they went on to pass. One IMG I worked with who had failed 2 times told me that, look, Dr. Brony, I think I'm done. But she wasn't done, right? We rebuilt her study plan from the ground up, and today she's a practicing physician licensed in Nova Scotia. Another one is almost getting licensed in Alberta. And the truth is that your story can also be the same. So I really need to listen to me. Failing in medicine is one of the hardest things you'll ever experience, because it's not just an exam. It feels like your identity, your future, your whole life is being judged by other people. But one thing you have to understand is that failure is not your final label. It's just a page in the story, and you still get to write the next chapter. And so if you failed or you are afraid of failing, I really need you to understand this. You are still a doctor, okay? And you are still worthy, because we have people in our lives who at times can make you feel that because you failed, you are not worth nothing. No, you are still a doctor, you are still worthy, and you can still practice medicine in Canada or or wherever you want to serve, whether North America, whether the UK, whether Australia, wherever, whether back home in Africa, Asia, wherever you have been called to serve, and so you will serve. And if you want guidance on how to bounce back, that's what we do at MedCognito. You don't have to figure this out alone. So for me, just click on the link below and just reach out to us. Reach out to us either by WhatsApp, by Facebook, or you can even just type a comment under this section and we will reach out to you. Let's go ahead and rebuild this dream together so that you can get back on your feet and become the doctor you've always dreamed of becoming. There's always a way out. All right. See you in the next video.